Hello and welcome to the Refugee Welcome Collective Lunch and Learn series. In these sessions, we aim to bring interesting and timely information to you, supporters of refugees. Whether you are a volunteer, community sponsor, resettlement agency staff, a local advocate, or just someone who is interested in learning more, we hope you enjoy today's session, the Refugee Health Assessment, an overview for sponsors and volunteers. Here at Refugee Welcome Collective, we collaborate with partners to provide in-depth training programs, weekly learning sessions, resources, and on-demand technical assistance for sponsors, practitioners at resettlement agencies, refugees paired with sponsors, community and institutional partners, and others to support quality community sponsorship programs across the United States. We thank the Center of Excellence in Newcomer Health for their partnership in today's Lunch and Learn. The Center of Excellence in Newcomer Health builds on existing infrastructure and its partners' extensive experience to identify and monitor newcomer health issues and needs, contribute to evidence-based policies and guidance, and ultimately improve continuity of care and health outcomes for newcomers. Let's see, as a note of housekeeping, as a reminder for everyone joining the Lunch and Learn today, there is a control panel in the upper right-hand corner of your screen that will allow you to submit questions through the questions box. There will be ample time at the end of the webinar for Q&A. Everyone on today's webinar is automatically muted. However, if you have any tech issues, please raise your hand through the control panel or submit a question in the questions box so we can assist you. Additionally, a recording will be sent to everyone of today's webinar. This brings us to our presenter for today. Our presenter is Lily Rubenstein. Lily is the Refugee Health Nurse Consultant for Refugee and International Health, for the Refugee and International Health Program at the Minnesota Department of Health. As part of her work, she ensures that refugees in Minnesota are able to receive refugee health assessment and access healthcare. She is a member of the Center of Excellence in Newcomer Health. Thank you for joining us, Lily.
Brianne. Hi, everyone. Thank you for having me. Thank you, Brianne. Thank you, Grace. So like Brianne said, I am a nurse at the Minnesota Department of Health Refugee Health Program. So just kind of a caveat, as we'll learn in a little bit, the process for the refugees health assessment is really different depending on where you are in the country. So I know intimately the Minnesota process, but this is going to be a really broad overview because it's so different from state to state. So we'll get into that in a little bit, but just kind of a caveat. So just to start off with some very dry definitions that are important to kind of center all of us on who we're talking about in the refugee health world, it is important for us to know immigration status, parole status, because that has pretty big implications for what benefits people are eligible for, including health benefits, and also how long they'll legally be in the United States. So refugee and asylee is a person outside his or her country of nationality who is unable or unwilling to return because of persecution or well-founded fear of persecution on account of race, religion, nationality, membership in a particular social group, or political opinion. So that's the definition a lot of us are really familiar with. Refugees who are a part of the State Department's reception and placement program are set up with a resettlement agency for at least 90 days after they arrive. This used to be all refugees, but with the private sponsorship program rolling out, those who are with a private sponsor will not be set up with a refugee resettlement agency. Humanitarian parole is something that's been around for quite a while, but we're seeing more and more people have this status. So this is an individual who comes to the United States for a temporary period of time for urgent humanitarian reasons. Everyone who's coming to the US right now under the Uniting for Ukraine program, which I imagine is why several of you are here, have this status of humanitarian parole. Some of these parolees have sponsors or supporters who are helping with things like finding housing and jobs, but not all. Next slide, Grace. And then two more. A special immigrant visa holder is given to individuals who provided services to the US while abroad. Again, some of these will work with resettlement agencies, but not all. And then certified victims of human trafficking is given to an individual who is a victim of severe form of trafficking. They generally will not work with resettlement agencies, currently not working with private sponsors or supporters, unless the resettlement agency has a special trafficking program. Not all do. Next slide. So this is just kind of centering us in the immigration world of who we're talking about today. So we're really at that bottom part there, persons fleeing from persecution. Next slide. Okay, so kind of taking a step back of why we're all here, the importance of being healthy. So resettling in a new country is really hard, very challenging. Learning a new language and culture, new job, new school, new friends, all of that while kind of worrying about friends and family back home, which is exceedingly difficult to do in a normal day, but much harder to do if you're not healthy. Further, the resettlement process itself can really exacerbate a lot of health problems or bring up new ones people never knew they had. It involves long travel, not a lot of sleep, different food, stress, anxiety, and often pretty substantial interruptions in healthcare. And then, just to top it all off, the understanding of healthcare and preventative care differs by population. So our understanding of what healthcare means and preventative care here in the US is really different from other cultures. Addressing health needs early in the resettlement process is imperative to a successful resettlement. That is why I work for a program. My whole job is setting up these people who are new to the country with healthcare. Next slide. Okay, so this part's going to be a little dry, but I think it's really important to know when you're in this world. There's 3 kind of big medical touch points for a newcomer during a typical refugee resettlement journey. They are all a little bit similar in what's done during the exam, but they're all done at very different times and for very different reasons. So the overseas medical exam happens first generally in the country of departure. This is given to refugees, special immigrant visa holders, family members joining asylees, and some humanitarian parolees. Generally happens between 3 to 6 months prior to departure, so remember that. So that can be quite a while before you end up seeing these folks. And the reason is to really help promote healthy resettlement and assess for diseases that may make someone a danger to themselves or others during or after travel for the resettlement period. It is a mandatory part of the refugee resettlement process. This medical exam is performed by a physician appointed by the US Embassy overseas in the country of departure. Generally, it's assessment and physical, some disease screening, and immunizations. Just a quick mention about this because many of you likely are currently working with humanitarian parolees from Ukraine. Because of the nature in which a lot of humanitarian parolees end up coming to the US with these very intense humanitarian situations, they may not have overgone an overseas medical exam. And that's okay, that's kind of understood as part of their immigration process. So we don't necessarily take it for granted that all humanitarian parolees have overgone this exam. Next slide. Adjustment of status exam. So this is very important because it is so often confused with the refugee resettlement exam for very legitimate reasons, both by supporters, volunteers, and new arrivals themselves. This tends to be, I would say, more well known as part of the health process of new arrivals than the refugee resettlement exam. So it just gets very confused in everyone's head. So this is an exam given to people who are applying for their green card or permanent residency status. This can be done for a refugee or several other immigration statuses, and then timing varies based on immigration status, which is way too much for us to get into today. It's very complicated, but generally for the groups that you are going to be working with, especially if they're refugees, it's about a year after arrival. During this exam, again, immunizations are updated and other diseases are assessed for. The important thing about this exam is it's done by a very specific practitioner here in the United States. It has to be someone who's been designated a civil surgeon by the US Citizenship and Immigration Services, USCIS. It is a mandatory part of applying for permanent residency. People have to pay out of pocket for this generally. It is an expensive exam, so we want to make sure that when they're getting in this exam, it's the appropriate timing and it's appropriate for them to get it at that time. Next slide. So in comparison, what we're going to be talking about today is called the domestic medical exam or the refugee health assessment, depending on kind of where you are in the country and how your state talks about it. This is not the adjustment of status exam. It's very different. This is done pretty soon after arrivals get here. Within 90 days is the goal, generally 30 to 90 days. And it's really to address any health-related issues and promote successful resettlement. So this is not tied to them getting a new immigration status, permanent residency. It's really meant to be that first touch point with the healthcare system and help kind of look for initial things that may present a barrier to successful resettlement and help get them hooked up in the primary care system. So it's kind of all the folks we just talked about in that humanitarian little bubble on that chart we saw. So refugees, asylees, those SIV holders, certified victims of human trafficking, and then some of the humanitarian parolees, which can get a little complicated and is nothing we really need to get into here. But generally, the folks that you will be working with will likely qualify for a refugee health assessment if you're working with them. It is performed by a licensed medical provider, so it does not necessarily have to be a civil surgeon. Sometimes there is overlap between these providers just because of their work or kind of what clinic they're in. It is based on CDC recommendations and includes disease screening and treatment, mental health screening, history and physical, and referral to ongoing care. And we'll get into that a little bit more later. Next slide. Okay, so before the refugee health assessment, the biggest thing, even before someone comes to the United States, if you're knowing that they're coming and you're expecting them, find out the process in your state. Like I said, every state has a different way that they kind of go about the logistics of the visit. So the components themselves is pretty similar from state to state, but how it's scheduled, who does it is really different. So many states have websites, especially now with the increase in the number of community partners involved. People are getting really good at having kind of public-facing information about this. So check out and see if your state has websites hosted by the state health department or the Department of Health and Human Services. Minnesota has both, but some places will only have them hosted in one place. Most states have a refugee health coordinator, not all, whose job it is to make sure that refugees can access refugee health assessments. So that's a great starting point too, if you kind of don't know where to go. That's public information. You can just kind of look it up online, or if you're working with an organization, they can help point you to that person. Some questions to ask, some things to think about. What clinics and providers do refugee health assessments in my state? This is not an assessment that you just kind of call up your local clinic and say, hi, I'd like to schedule a refugee health assessment. Unless you're super lucky with where you're located, they're probably not going to know what you're talking about. And they may, in fact, confuse it for an adjustment of status exam, which would really be too bad. And then how do I get that scheduled? So we'll go into that a little bit more later. If you're working with a resettlement agency, discuss the process with the case manager. This is a required part of resettlement, either for a sponsor, a supporter, or case manager. So they're likely well aware of the process in their state, and either they're already taking care of it or they can give you great tips on how to schedule that exam. Next slide. So components of the refugee health assessment. Again, this is based on CDC recommendations that are done by experts in the field. They're updated periodically based on new research and new care protocols in the country. History and physical, immunizations, mental health screening, nutrition and growth, sexual and reproductive health, a lot of screening for diseases as well as treatment if anything comes up positive. The specifics of the exam are based on an individual's age, sex, country of origin, and health history. So not every exam will involve all of these components. So it can get a little complicated for providers to kind of know who to do what for. So that's nothing we would ever expect a sponsor or supporter to know. But if it comes up, right, that someone is saying, well, what's going to happen during this exam? You can kind of talk about, well, they're going to talk to you about your health history. They're going to update your immunizations. They're going to make sure you're feeling okay. And they're going to do some lab work to make sure you don't have any illness that we can just kind of easily treat so it doesn't get worse. Next slide. Okay, so I'm going to spend a little bit of time on this, the difference between refugee health assessments and primary care. So this is going to be really state specific for you, how this process works in practice. So A refugee health assessment is not the same as a physical, a complete physical, what we know is a yearly physical here in the US, or a typical new patient exam. So for example, if you're going to a new clinic and you say, I want to establish care with a new provider, right? They might say, well, we have this 40-minute visit we need to do to get to know you, go over your health history. It's not the same thing as a refugee health assessment. They do share many of the same components, a history and physical, looking at immunizations, some lab work, things like that. But people born in other countries who go through the resettlement process have really different health needs that other populations do not have, particularly domestic populations, people born in the United States. This includes things as like different diseases that have different prevalence in different countries for various reasons, intestinal parasites that we just don't have here in the US because of climate, different immunizations that were given overseas. There's a lot of kind of catch up to make sure they fit our US schedule so they can go to school and work in healthcare if needed. Mental health screening because of the stress of the resettlement process. So the reason we have this exam, and it's not just saying we'll make an appointment at your local clinic with your local doctor, is because it consists of things we know are really, really important for new arrivals. So saying that, every state has these providers who know how to do this exam in different places. Here in Minnesota, we have a model where we have mostly clinics, primary care clinics, who have providers who are interested in refugee health and have agreed to do the refugee health screening. In other states, they have clinics where they only do refugee health screenings and that's it. So they're very specialized in that care. Some people have them done at local health clinics who then will also do immunizations and TB care, but that's it. So it's really important to know in your state what their process is. So sometimes that clinic where one receives a refugee health assessment can and will become their primary care clinic. This depends on what the clinic is, the geography, if they're close by, if the newcomer had a good relationship with that provider, kind of all the stuff that we look for in a primary care doctor as well. Sometimes that clinic won't be able to provide primary care. Generally, if that's the case, there will be a discussion during the visit that that's something that the new arrival needs to figure out, really, finding a primary care provider. So depending on who's assisting them with that, maybe it's you, maybe they feel comfortable doing it on their own, maybe it's a case manager or a friend or other supporter, they will find a new primary care clinic close by. All right, next slide. All right, a word about what we call PHI in the health world, protected health information and patient privacy. So your role as a supporter or a sponsor or a volunteer is really to help with what we call coordination and access to healthcare. Your role is not to become their provider. It's not to kind of know what labs they're getting and what the results are. It's not to know their history. It's really to facilitate them getting to the right person to get that stuff taken care of. These rules and laws will differ from state to state and depending on your role, but generally you are not given access to private health information, especially from the provider or the public health staff. So how much health information you know about an individual is really up to them. I recommend having this conversation early. Depending on your relationship with the individual, it may make sense to have this right away. It may make sense to have it after the visit is complete. Sponsors and volunteers will not be in the exam room during the assessment, right? That's not appropriate. A provider would not allow that unless the individual explicitly asks, which in my experience is generally not the case. After the visit, I just recommend asking really broadly and generally, is there any follow-up you want assistance with, right? Leave the decision and the responsibility to think about that on the individual. We want to make sure we're not kind of prying into their private health matters, but that you're there as a resource if needed. And everyone's going to be really different on what they want. They may feel comfortable telling you what happened during the exam and say, these are some things I need, or they may say, you know what, I can take care of all of it. Just make sure I have a cell phone that works and I know how to access an interpreter. It's really going to run the gamut depending on the person. Next slide. Okay, So support after the refugee health assessment. I'm going to spend some time on this too. So the refugee health assessment is really just meant to be the first step in kind of the long journey of health when they're here. Again, ask the individual kind of what assistance they would like with follow-up. Some things to consider. Again, will this clinic or provider be the primary care provider? If not, kind of how does that process work? Is there a local clinic that's recommended that takes great care of newcomers and is really comfortable using interpreters? How can we ensure medical records get to the next clinic? Sometimes there's just some logistical pieces to figure out, signing a release of information, making sure they have the right fax number. Are there any issues that need to follow up with a specialist? So if someone is referred to cardiology or something like that, who makes that appointment? Is that something the individual is expected to do, or will the clinic follow up with them? That's often discussed during the visit, so if the individual wants help with that, they can talk to you about that. When and where should this individual have their next clinic visit? Depending on what happens during the visit and their own unique health history, again, this can range from maybe they want to see them in a couple days to maybe they need a well child check in 2 months, right? This can really be different depending on the individual. So it's important to know kind of based on the exam and what the provider says, when should they have that next touch point with their clinic, whether it's primary care, specialty care, or this clinic where they had their refugee health assessment. And then
Lily,
last thing, oh yeah.
Lily, I can also mention that that some of your colleagues from the Center of Excellence in Newcomer Health also did a lunch and learn connecting newcomers with healthcare providers for ongoing access, and it's in our resource library. So also many of the things that you're hitting right here, but if folks were interested in that, they could also check out that lunch and learn.
Yes, and that was done by like some of the best primary care providers in refugee health in the country. So you are in good hands.
It was a good panel. It was a good panel.
It's a great panel. And then lastly, and this is near and dear to my heart because I was previously a nurse care coordinator at a clinic who worked with a lot of refugee and immigrant patients, is there support within the clinic who's going to be helping this newcomer? This is something that can be new to people if they've never had the need to use these supports for one reason or another, but many clinics, especially those that are used to serving folks who maybe need an extra hand, especially when they're new to the country as far as navigating, knowing who to call, navigating interpreter services, things like that, often have a social worker or a care coordinator who can provide some extra support. So it's good to just kind of have that general conversation with the clinic, especially the primary care clinic where they'll be going. Is there someone here who's able to assist with this healthcare navigation, and how? Next slide. Okay, I'm running through this, so we'll have plenty of time for questions. So just some takeaways. Find out the process in your state early, either through the refugee health coordinator or the resettlement agency. It's going to look really different from state to state. The Minnesota model, just to give you some context, is that we actually use our colleagues at the local level and local public health to coordinate the whole assessment. So once we know a new arrival is here, we have great nurses in every county who will reach out to the clinic, reach out to either the sponsor or the case manager, and take care of everything. So it's important to know that, right? So you as a sponsor or supporter aren't kind of cold calling these clinics trying to schedule something that we already have a great infrastructure for. Think about health early. Hopefully everyone you interact with will be super healthy and it won't be an issue, but it's so good to be able to nip those things in the bud when they come up. We want to make sure people have all the medication they need. If they have a chronic medical condition, we want to make sure they're getting care. You want to make sure that's not kind of an afterthought after a couple months when you've done the rest of the stuff. It can be really easy, we have found, with all the competing priorities of resettlement, to forget about health, especially for people who are not used to going to a clinic regularly because they've had such kind of fractured healthcare because of where they're coming from. So it's really going to be partially your responsibility to make sure that that stays on the front burner. Have a conversation about privacy and your involvement in healthcare. Again, kind of when you have this conversation, whether before or after the visit, is going to depend really on your relationship with the client, and how involved you are is going to depend on both their comfort level and your comfort level. If you are a nurse or a provider who has a lot of comfort level in navigating the system, maybe you feel more comfortable being more involved. If not, maybe you really want to make sure that there's a care coordinator at the clinic where they're getting primary care that can help. Then, and this is so important, the health journey does not end with the refugee health assessment, right? So this is really meant to be the first step in someone's health journey. And the webinar Brianne mentioned talks a lot more about that, but oftentimes we kind of do this really complex visit full of things. It can be a little surface level, right? Because there's tons of components for it. So we really want to make sure people have the opportunity to have good conversations with someone that they trust, a provider they trust about their health, and that they're really having a long-term view of health and understanding kind of preventative care, that we do yearly physicals, things like that. The other thing that's good to keep in mind is that needs can change really dramatically from kind of that first week to the next month, especially from a mental health perspective, right? Things can come up kind of later on that weren't necessarily there in the beginning, with stress and anxiety, and once the adrenaline of this journey wears off. And so maybe they really felt okay and didn't have a lot of needs at that initial refugee health assessment, but you're noticing that maybe they have new needs a month or so on, and that's an appropriate time to kind of loop back around and help get in with a primary care provider just to do another assessment if needed. And then this, I think, hopefully was a little implicit throughout the presentation, but really the ultimate goal is independence in navigating the healthcare system. So as much as you can involve the new arrivals that you're working with and kind of your logistical organization and the processes that you're doing is great. Again, there is a lot going on in the initial couple months of resettlement, really the first year to however long, and making sure that you're kind of giving them the tools to succeed when you are no longer there assisting is really important. So as much as you can kind of learn how to access an interpreter when you call, help people learn that it's important that they can say their name, date of birth, and all the information you need when you call your clinic. Things like that that you maybe take for granted is knowing, making sure that folks really understand that information moving forward. Next slide. And that is it. I'm about 5 minutes early, so we have plenty of time for questions.
But we've already got some questions, so no worries.
Oh, great.
We're gonna begin answering any questions submitted during today's presentation. And as a reminder, you can still submit questions through the questions pane in the attendee control panel. Let's see, so a few questions. Let's see, how is the refugee health assessment paid for? And then if there is any like follow-up care that comes up out of the refugee health assessment, how is that paid for?
Great question. So and I'm not going to get too into the weeds on this because believe it or not, health insurance does not fall under my purview, but it's at the Department of Health and Human Services. So all refugees and asylees and special immigrant visa holders, certified victims of human trafficking, and those parolee groups that receive what we call refugee benefits. So that's the Uniting for Ukraine folks, those that came under Operation Allies Welcome from Afghanistan, they are eligible for health insurance. That's kind of part of the deal. That's part of refugee benefits. The refugee health assessment is covered by health insurance. So generally, almost all arrivals will likely be placed on, and this is going to differ a little from state to state, but likely placed on kind of on a state insurance because of their income level when they arrive. There are some details to that are pretty complex. If someone's meeting a family member, they may be put on a different insurance or have to go through a marketplace. But in general, people will be put on the state insurance right away. And this insurance will cover the refugee health assessment. This is a great conversation to have with your refugee health coordinator too. That's a big part of their role, is to make sure that there are ways to get these covered if there's issues with insurance. So there should not be out-of-pocket fees associated with this exam. And then, sorry, Brianne, was there a second part of the question about follow-up?
It was just how is follow-up paid for or what have you?
Yeah, so generally that would be covered as well under insurance. The kind of the understanding with refugee benefits is these are folks that are likely going to be in the United States for a long time, if not forever. Many of them end up becoming citizens, and so what health insurance they end up being on, it kind of depends on the job, their income level, things like that, but they are eligible for health insurance similarly as someone who's living in the United States is.
We had someone ask about, they think in their state, Kentucky, for example, the appointment is split into 2. Is that normal, or do you think that they're covering more topics, or have you heard of other states where?
Great question. This is another thing that everyone does a little differently, and just to complicate it, sometimes every clinic will do things differently, even within a state. In Minnesota, we have several different models depending on where people go. I would say the 2-visit model is most common here in Minnesota, so I would guess it's common elsewhere too. And that can be dependent on just kind of the clinic workflow. So because there's so many labs that happen during the first visit, and there's just so much to get through and learning a person's entire medical history the first time you meet them, they'll often go through, let's say, the lab work, the first visit, maybe an initial health history, or they'll even have a nurse who specializes in refugee health, or a support staff who's been trained to go over that with the client. And then they'll come back for a second visit. They'll have the results of the labs. They'll be able to go through everything, formulate a follow-up plan, and then give immunization. So I would say that's a pretty typical 2-visit process. But again, this is going to be different based on your state and the clinic. So that's a great thing kind of within the scheduling process. That's a great question to ask. Kind of, is this 1 visit? Is it 2 visits? Generally in Minnesota, we have the 2 visits, I would say about 2 weeks apart, depending on the clinic. So it's still done pretty quickly back to back. But yeah, 2 visits is, I would say, the norm here in Minnesota.
Good to know, and schedule accordingly with all the other things going on at arrival. Someone asked, and you briefly touched on this, if the newcomer is on medication or is on insulin, how is the process coordinated to maintain continuous access for arrival?
Yeah, that's a great thing to think about. And actually, I'm not sure if Kate and team talk about this in their webinar, but if someone comes in with what we call a more acute or complex medical need, like they have diabetes and they're on insulin, that's something that might need a little more work on the front end than just your typical refugee health assessment. For those arrivals that go through the overseas medical exam and kind of go through this prolonged process, which is usually refugees, some parolees, they will be given, ideally, a couple months worth of medication prior to leaving. So they should have that. Of course, things happen. They're not given the medication. Medication is lost, et cetera, et cetera. So that'll kind of depend on your relationship with the individual. I would say in general, and I am going to touch super lightly on this because I'm not sure what's happening. In general, with the refugee sponsorship, these people with super complex medical needs are probably more likely to work with the resettlement case manager, especially in the start, because they're going to have a lot more going on. However, if you do have a new arrival and you know that they have those needs, it might be appropriate to just schedule a really quick visit with a provider that's not a refugee health assessment, right? And that's something that your state refugee health coordinator or a refugee case manager can really help you walk through if you have concerns about acute medical needs.
Yeah, let's see, I guess, let's see which, someone asked, and you might be able to speak to this in Minnesota, about any success working with the NEMT program and helping refugees gain access to transportation for appointments. And I think NEMT, it's like non-emergency, I don't know, is it like
Oh,
non-emergency
transportation?
transportation or something like that?
We have different names for it here. Yeah. Yes, so that's another thing to kind of learn about. I'm going to talk about this in a very Minnesota specific way because I do not know how things work in other states. But here in Minnesota, our state sponsored medical plans, medical assistance, have a non-emergency medical transportation kind of program with all of them set up. So as a sponsor supporter, you may want to give rides to people the first couple times, right? Because it can be tough to get to a new clinic. But in terms of both kind of your life and ensuring that the individual can become independent, it would be great to learn about the non-emergency medical transportation associated with their care plan if there is one. This is something that the individual's insurance can probably help you with. Sometimes it's as simple as a Google search, sometimes calling the number on the back of the card. This is also something that the clinic is probably going to be a big support with. Most all the clinics who do refugee health assessments are not only good at kind of the clinical components of a refugee health assessment, but they also really get all that extra stuff that comes with working with a new arrival. That includes helping with transportation, making sure people can get to places that they're unfamiliar with, all that stuff. So I would say, yeah, that's a thing that we rely on heavily here in Minnesota. When I worked at a clinic, I had patients who ended up being on that for years and years and years and using that system, and it was wonderful. We use it all the time. So that's something that is great to look into. And kind of on that note too, part of independence in the healthcare system is knowing where to go for supports and those kind of extra supports. So I would say it's going to be kind of a dance between someone's insurance and their clinic, what supports can be given. Sometimes there's an interpreter line people can call who can then help connect them to where they need to go within the medical system, which is great. The non-emergency medical transportation. Sometimes there's extra non-medical items that insurance will help pay for, like fresh food and things like that. So that's another way to kind of prepare for your arrival to come, is to know what sort of resources are available, those kind of extras that are available in your state.
Let's see. I have a question for about the overseas medical exam. So I don't know if this is a question you can speak to or not. But are there some medical conditions that would prevent them from traveling to the U.S.?
Yes, that is a good question. I do know the answer to that. So yes, however, I will say not forever. So generally, if there's a medical condition that is noted on the overseas medical exam, and a very common one we talk about is active tuberculosis. So that's one thing that's very heavily screened for in the overseas medical exam, because we want to be really careful about someone with active tuberculosis. Flying, coming to the United States, going through an airport. So that is assessed for on every individual prior to coming over during that overseas medical exam. If they are determined to have active tuberculosis, they go through treatment, and then they can resume their resettlement journey. So it's not to say that they are never allowed to travel or not allowed to resettle. They just need to be kind of either stabilized or given treatment if it's an infectious disease. The other thing we sometimes see is someone who has a chronic disease that maybe hasn't been managed well because of kind of the situation in which they found themselves in a refugee camp without ongoing care. So generally that provider during the overseas medical exam will say they need an inpatient hospital admission for a week prior to departure for stabilization, right? They really do their due diligence to make sure someone is stable and safe prior to coming over. So while that overseas medical exam is searching for this horrible term called excludable conditions, almost exclusively those conditions are addressed, and then someone comes to the United States.
And similarly, like if any of these conditions are identified in the refugee health assessment, right, like they are also going to be addressed with some sort of treatment plan.
Yes,
Let's see, Someone asked, and this is kind of getting into ongoing healthcare, many Ukrainians coming as humanitarian parolees are eligible for Medicaid. Do you have any advice on how to find the right PCP? Is that primary care provider?
Primary care provider, yep.
Provider, yes.
Probably not any more than you have, honestly, audience member, as far as navigating the healthcare system. I would say, depending on kind of your network and your relationship with local resettlement agencies, I would say it's appropriate to ask around to look and see where newcomers go for care, right? There are definitely some clinics that have more familiarity working with people who are not born in the United States and kind of the special health needs that can come along with that. In terms of care coordination, interpreter needs, all that sort of stuff. So it's a little bit a matter of finding where those clinics are and who those clinics are. As far as specific providers, the dream is always to find a provider who speaks Ukrainian or whatever, which is sometimes super doable depending on where you live and what language you're looking for. Oftentimes not. That stuff tends to kind of come naturally in the community as people come more and more. I would say here in Minnesota, we definitely have found some clinics that have Ukrainian providers that are getting a lot more patients suddenly for very obvious reasons. I know Washington State worked on making an actual provider directory of providers who spoke Ukrainian and Russian. It's probably worth looking into if your state has something like that as well. And the unfortunate thing, which might be a conversation to have with someone you're working with, is that the first person you see may not be a good fit, and that's okay, right? It's kind of frustrating to have these long conversations with someone and then realize that they're not a primary care provider that you feel comfortable going to. But if that happens, it's good, just like with you and I, to say, you know what, there's different providers both at that clinic and in this city that we can try. Just making sure that people know that they're not kind of stuck with that first person they see.
And someone was just commenting too that it might be helpful just to mention, point out again that Ukrainian humanitarian parolees are eligible for the refugee health assessment. Correct?
Yep. Yeah. Yep, they are.
Perfect. Let me see. This one, and maybe I can help too. Someone was just asking, does the organization have someone to do this, or is it done by case managers? And I feel like we could answer that question in a few different ways. The refugee health assessment is usually done by the healthcare provider. Yeah. And so I think this might be asking about like organizations such as a resettlement agency for those newcomers that are working with a resettlement agency. I'd say that in most cases, the regular case manager may set this up or make this appointment. Sometimes maybe even before the person's arrived, or like Lily referenced, some people might have like a special medical case manager. So in I think some rare instances, maybe that person might do it. But I'd say if the organization you're referring to is a resettlement agency, I'd say usually it's the case manager, or maybe, if you're a co-sponsor, they may have like the information to give you or what have you about the appointment. But yeah, does that sound okay by you, Lily?
Yeah, totally. And it's tough. And Brianna's actually been teaching me a lot. There's really big, exciting new changes coming in resettlement. So that's why we're all kind of being careful with the words we use and how we talk about whose responsibility is what, because the private sponsorship program is really new to us. So we're still kind of figuring out that dance. But the refugee health assessment is a long established part of the refugee resettlement process. So resettlement case managers are well aware of the health assessment. They might call it something else. They might call it the domestic medical exam or something like that. But yeah, that should be kind of a part of their predetermined workflow.
And this is a tough, a tough question, but I'll ask it anyway, just in case. And I can share some thoughts as well. Lily, do you have any thoughts on how to engage with clients about mental health needs if they come from cultures where there is stigma?
Oh, yeah, that's really hard. And I would say a lot of my days are spent thinking about that very question.
And I can also point folks, I know it hasn't been recently, but like even in the last year, I know there have been some webinars more specifically on
Yeah.
mental health issues. And actually quite recently, someone had pointed me towards which I've pointed people to other resources on the USA Hello website before as well. But I think someone recently had pointed out to me the mental health section on USA Hello, and there was some good resources there.
Oh, great. Yeah,
But
I'm sure. Yeah, that's a great point. So there are resources. There's not enough, but depending on the community you're working with an individual, there's definitely uh, research and kind of thoughts that have been formulated by experts online on how to approach those conversations. I would say as a supporter or a sponsor, it is not your responsibility, right, to kind of recognize or diagnose a mental health need in somebody. But if that comes up in kind of your natural relationship with them, or it's something you want to be proactive about, and this is something that people who maybe don't have mental health needs in their daily thing don't really think about, but a primary care provider is the perfect person to kind of have that conversation. They tend to be well versed, especially if they're used to working with people, to having those conversations about referrals and what to do. And sometimes if it's a mental health need they can manage in clinic, and patients might really appreciate that, right? Because they already have that relationship. I would say it's kind of, there's so many nuances, right? It's like, are you talking with the individual with an interpreter, or are you both speaking English, and kind of what words do you use? Um, how lightly should you tread about certain words, like saying, you seem like your mental health is really bad right now, maybe isn't the right way to talk about something, but saying, normalizing and saying it, resettlement is so hard. And I know from kind of learning about resettlement that it's challenging for everybody, and people can feel differently depending on where they are in the resettlement process, and it can be really stressful, and you're worrying about people back home. And primary care doctors are really good at talking to you about that, and helping you feel better and making sure it's not going to interfere with your life and your job and things like that. But it's so culture specific, it's often gender specific, age specific. So I would really, depending on who you are working with, do a little research, a little lit review kind of prior to the arrival, and kind of figure out resources that are available. The other thing we know with resettlement is it can be really isolating for people, which can be really tough, right? Especially if you're coming from really anywhere. You're coming from a community where you lived with your friends and family for years. You're coming from a refugee camp that you were at for many years. And then suddenly you're kind of here in the United States living in an apartment next to people who don't speak your language, don't know your culture. That can feel really, really isolating for people. So as much as you can, connecting folks to organizations specific to their culture right when they get here. In Minnesota, we have great, like the Afghan Cultural Society, we have Karen Organization in Minnesota, and a lot of states have places like that that just hold kind of non-mental health related events that can be really nice for people to find a community, which can really help with that isolation and anxiety and stress people feel. So that's another good way to kind of think about those things without having that explicit conversation.
thank you. And then we're a little bit over even, but one last question, because a few different folks had asked it too. But what about the kids? Did the kids go to the refugee health assessment, or?
Yes, I probably should have. It's all ages. So everyone, 0 to whatever, has a refugee health assessment. So for kiddos, they'll do probably some different things, different screenings, but it's super important for kids as well. And for kids to keep in mind too, as we all know, kids have a lot of doctor's appointments when they're young. So that's a good conversation to have, just about what preventative care is and why kids have to go to the doctor all the time. Doesn't mean they're sick. It means there's developmental screening, immunizations, which are wonderful, kind of all those conversations that come with learning about preventative care. But yep, refugee health assessment is for everyone of all ages.
Very good. Okay. Great. Let's see. So thank you, Lily, and thank you
Thank
to
you. Thanks, everyone.
everyone who also attended today. And also, we'd like to hear from everyone who attended today. We'd like to receive any feedback on today's Lunch and Learn and hear your suggestions for future Lunch and Learn topics. We ask that you take a moment right now to complete a survey. You can use your phone to follow the QR code on the screen, or you can follow the link in the chat. We look forward to hearing from you. Today you will receive a follow-up email with a link to view the recording of today's webinar. And on behalf of the Refugee Welcome Collective, thank you so much for joining us. We hope, I know I enjoyed hearing what Lily had to share, and we hope that you also have a great rest of your day.